Hi, I'm Dr. Tim Free. I'm here with my patient Shane, and we're talking about post-surgical rehab on his ACL. But what we're going to do today is I'm going to introduce you to the type of techniques that we're using for his rehab. We use class 4 laser therapy, we use hyperbaric oxygen, and we also use rock tape. So right now we'll take off the brace and see what this thing's looking like now. The tape you see right here, this is rock tape, and I've taped it in a way that kind of looks like a spider web or a really bad tribal tattoo. What that does is it actually increases the lymphatic drainage. When you tape it along, say, lymphatic channels, or you tape it along muscle fibers, you cause a couple things to happen. First thing that happens in this setting is, well, when you have all these little pieces of tape, it will pull up the fluid-filled channels that will help lymphatics drain. If you were to tape it differently, you can help increase blood flow, increase muscle contraction, decrease inflammation. So what we'll first look at right now is taking this tape off. And you can see right here where the tape just was, there's no color. Right here there's color, right here there's color, but the tape pulls the skin up, and the other therapies that we combined decrease how much inflammation's in there. So when you bring in the blood, you're going to get new nutrients, and it's going to help the cells heal. And that's also what the class 4 laser does, and we'll get into that in a second on how it works. And then we complete the system by super saturating it with oxygen in the chamber.
About 17 days post-op. I'm feeling pretty good. I've had the same surgery on my left knee about 7 years ago. I had some complications with the rehab. Had some swelling complications, and it really took a lot longer than where I'm at now. At this point, last time I was still bedridden. I couldn't get up without pain. It was just really a terrible experience.
So I'm gonna put on some safety glasses for everyone. Lightforce has a great machine. This is the Lightforce EX. It's a 15 watt class 4 laser, and they have pre-calibrated settings that are region and condition based. So I can go to the body here, I can click on his right knee, and right here I have post-surgical knee.
After the first treatment, the pain was manageable. It was still there, but it was nowhere near what it was before the first treatment. After the second and third treatments, that pain was barely there. I could barely feel it anymore, and that was just the first week of treatments through.
The great thing about having 15 watts of power is, based upon the severity of it, if it's acute, you can dial the power back. If it's a chronic case, you can crank it all the way up to 15 watts. You want to be careful on how much energy and how much heat you're causing in an area, just like any acute situation. So in his case, 17 days out, what I'm going to do is I'm just going to increase it up to about 9 watts. So what you just saw earlier is we did class 4 laser therapy. We took off his rock tape. We're not going to reapply it today because we want to give his skin a little bit of a break. But the last therapy that we do at the very end is hyperbaric oxygen. Now, hyperbaric oxygen works under Henry's law in physics, where if you take gas and put it under pressure, it causes the gas to become easier dissolved in liquid. Well, he is made up mostly of water, and so what we can do is, in a second, we'll turn on the air compressor and we'll turn on the oxygen concentrator. He will be at 4 pounds per square inch, 1.31 atmospheres, while breathing 90% oxygen through an oxygen concentrator. The great thing about that is it does a couple of things we need for him to heal faster. So hyperbaric oxygen, one, when you use oxygen under pressure, it stimulates the DNA of the damaged cells to signal stem cells into that area. It increases angiogenesis, which is the production of new blood vessels. It decreases inflammation, and if you go back to the laser, We did a post-surgical setting to excite the cells that are going to break down the scar tissue and heal. This is a pressure gauge right here. It's going to reach 4 psi inside, and it's going to maintain that pressure for the next 60 minutes while we flood his system with oxygen and get him closer to the road to recovery.